My name's Lauren, and this is my anatomy bone video. So this is a clavicle. It is a left clavicle, and the way you can tell that is there's going to be a rough end or a rough edge on the bottom, and it's going to be smooth on the top. So this is the sternal end because it's the medial end, so it attaches to the sternum, and then the acromial end is the lateral end. This is a scapula. We have the acromial process up here, which is one way to tell if it's left or right. So this one is going to be a right scapula because the acromion process is sticking out, and it's the most lateral part. This is the lateral border. The inferior angle is right here, and the medial border is on this edge right here. This is the sternal angle, the superior angle, and we have the superior border, the superior notch, suprascapular notch. This is the scapula. It is a right scapula. This is the lateral border, the medial border. This is the superior border, and this is the superior angle. This is the inferior angle. The glenoid fossa is right here, and this is the acromion process. The spine, this is the coracoid process. The supraspinous process is right here. The subscapular fossa is here, and this is the suprascapular notch, and the infraspinous fossa is on the front where the body is. This is the humerus. It is a left humerus, and this is the head. The surgical neck is right here. The anatomical neck goes around the edge of the head. This is the greater tubercle, the lesser tubercle, and this is the intratubercular groove. The deltoid tuberosity is on the side right here. It's rough and it sticks out a little. The medial epicondyle is right here. This is the lateral epicondyle. The capitulum is right here, and then beside that is the trochlea, and it goes around to the back. The coronoid fossa is right above the trochlea, and the radial fossa is right beside that. Then on the back you have the olecranon fossa. This is a radius. It is the right radius. Here is the styloid process. It points towards the big thumb, the thumb. Then you have the head of the radius. Here's the neck, and this is the radial tuberosity. So this is an ulna. It is a right ulna. The styloid process points to the pinky. Here's the head of the ulna. This is the trochlear notch. This is the coronoid process, this little sled type thing, and this is the olecranon process, and the radial notch is right on the side. This is the hand, and there are 8 carpals. There's a proximal row and a distal row. The proximal bones are the scaphoid, the lunate, the triquetral, and the pisiform. The distal row is the trapezium, the trapezoid, the capitate, and then the hamate. These are the metacarpals, and then these are the phalanges. So we have, when numbering in an anatomical position, you start from the most lateral, so the thumb would be 1, 2, 3, 4, and 5. On the pollex, it has proximal and distal, but on the rest of the phalanges, there's a proximal, a middle, and a distal. So there are 3 different arches for the foot. This side has the lateral longitudinal arch. This is the medial longitudinal arch. And then this right here would be the transverse arch. There are 3 different bones in the foot that are important. This is the calcaneus, which is what forms the heel bone. This bone is the navicular because it's boat shaped, so think of navy. And then this is the talus, which goes right below right above the calcaneus. So this is a foot, and there are 7 tarsals. We have the calcaneus, the talus, the navicular, and the 3 bones right here are the cuneiforms, and then the cuboidal. These are the metatarsals, and this part, the distal part, is the head, and the proximal part is the base. With your foot, you number medial to lateral. So the part of the hallux and the metatarsal will be 1, 2, 3, 4, and 5. So this is the hallux, and on the hallux they have a proximal and distal bone, and then the rest of the phalanges have a proximal, middle, and distal.